So, Save a Tooth Foundation. You've heard of Save a Dog Foundation. Save a Tooth Foundation. Can we save the tooth or not? And how do we know whether the tooth is vital or not? How do we assess it? So what you need to do, as every animal dentist knows, is take an x-ray and see how viable the pulp cavity is. Is the inside of the tooth healthy? So we've just taken an x-ray. If you take
one.
Yeah, so this is a canine tooth, and you can actually see there's a large chip on the side of it. There's major trauma to the tooth. Mm-hmm. And if you'd like to come round, I'll try and show the mouth. So here is where the trauma is. This is the trauma to the tooth, but the pulp cavity is still intact. This is the pulp, or the vital part of the tooth. So this is a canine tooth, the biggest tooth in the mouth, and it's a tooth that you want to save if you can. So the tooth next to it looks healthy. The teeth around it look good. They're nice, healthy teeth. But this is okay. So I'm going to clean it out, and it's called sealing and bonding, and putting a small bit of composite there. And this tooth should be great. We're not going to need to take out the tooth. So we try and save teeth like in people, especially if it's a major tooth. It's actually easier to save the tooth than to take it out. Taking out a tooth like that is really difficult. So this dog's lucky, he's got no cares, and we're going to save Patch's little tooth. So can you kind of see how deformed this tooth is? And if you can't see, the X-ray shows it the best. I don't know if the light makes it better or worse. But the best thing, the X-ray. I mean, you can see,
the X-ray.
but you can see that you can see half the tooth is missing.
What you're doing right now is just cleaning?
Just cleaning.
Where's that second heat now? Which one's the second one?
It's under here.
Yeah, which one's now?
What is that you use to clean, Phil?
So at this stage, I'm just using a dental ultrasonic scaler, and I'm very gently cleaning any plaque and tartar off. I'm then going to use a special, it's called pumice. I'm going to polish and clean it. And then I'll show you the next step. We're going to acid etch and bond it. We're then going to put some composite, and then we're going to smooth it again. Next step is to acid etch. What the acid does is it takes the dentine and opens the tubules, and then I'm going to bonding agent that will seal it. And that will make it a much more solid. Even if my new composite comes off, this tooth will be a lot better off. So guys, I'm going to etch for approximately 20 seconds. Oh, I need my... So if the vet's watching, you take an acid etch. It's just a strong acid solution, phosphoric acid.
20 seconds mark.
Now, so I'm painting the area that I'm going to be sealing, and a little bit around it as well.
Continuing until the beat. 5, 2, 1.
How long was that timer for?
20 seconds. So what I'll do is, so I'm going to wipe it off. I don't want to get acid in his mouth. I'm then going to gently clean it off and start drying it. So we've got a nice surface that's now clean and open. This is called a bonding agent, and it's going to now seal those tubules. And this is one of the very, very important steps in making sure this tooth lasts forever, because my composite may come off. This is a canine, it's a Jack Russell, and anyone who's had a Jack Russell knows they're big dogs in little bodies. They're powerful, they eat, got very strong teeth. So if he chews or bites at balls and stones, my filling could come off, but this sealing now will stay on forever. So this is a bonding agent, and the only way to really get the bonding agent into the tooth, we have to light cure it. So I don't know if the camera's allowed to look at the light cure.
We have some leeway, so I'm just going to bump the fluids up a notch.
So we're going to light cure the area.
Yeah, because the stomach has been dropping.
So now that I've bonded, we've actually got a really smooth, clean tooth, and now I'm going to put a little bit of a filling onto it. And I'm not overly worried if that filling doesn't stay on.
Just imagine how gross mashed peas are now.
Well, I mean, you're going to eat that, but soon you're going to realize like you can't. It's just very unhealthy.
So easy to set off with.
It's hilarious.
Yeah, there's probably going to be mashed peas in it.
Great.
You will love the vegan burger you're having for lunch.
I better.
You know what we're trying in this practice? We're trying to save a tooth. There's save a dog, save a tooth, and save an animal. It'd be so nice to have a meal that's cruelty free, and that's why we generally have vegan burgers, vegan meat, vegan food. Just so we've got a thin layer of composite. Look at the light. And this will now seal. So you're going to we've got about a 1 millimeter seal on this tooth, and it'll, the stuff seals really well. And this light curing makes it, I'll be able to, right now you can put, just like when you go to the dentist, you can actually eat straight after the procedure. So 30, straight after this, it should be pretty hard.
Music choice is better than Justin Bieber like it was the other day, guys.
I would beg to differ. Justin Bieber's so good.
Says the 12-year-old.
I could say so many things right now, but I'm gonna not.
I mean, just because I look like I'm 30.
So what are you doing right now?
So I'm just going to measure. I'm going to put a tiny bit more composite, and then I'm going to finish. And we'll try and show you what it looks like. You'll come on the side how good it's actually looking in the tooth now.
Try it like this.
So I'm very, very happy with the outcome.
You have that thing on them.
Oh,
Mine broke off.
doesn't.
Mine broke off.
So the orange thing is a shield that shields.
So it's a
you from
shield,
the
so I can see the lights on it. For some reason, you're not supposed to look at it like a welding light, and the temptation to look at it's very, very high. I mean, I can see it on that side because it's coming through the light, but it's a shield.
light. It doesn't actually show up on the camera. It just comes up as a white light on the camera. It's actually like an ultraviolet.
It is an ultraviolet light, and it comes out as a very fluorescent blue color. And it's hard to see. So we've added about 3 millimeters of tooth at the base, which is at the jaw, at the gum line, and about 2 millimeters higher up. And now I'm going to smooth it down. It looks pretty good. So it looks pretty much like a functional tooth, and this tooth should be in much better shape regardless of what happens to where the vicissitudes of life. So the big thing now is I don't want this tooth to get damaged, so I have to smooth it down. I'm going to do different levels of smoothing. We're going to smooth it with different sandpapers.
Is this a common thing, Phil? Can you regularly save teeth like this?
Well, yes. We normally like them very early, but this particular case hasn't gone into pulp cavity, so the point is that,
So the sooner they act on dental damage, the better.
usually the sooner, especially if it's a vital tooth like a canine, we can just cap the tooth. If we get it very, very early, we can just cap the tooth. And that's the perfect outcome.
I could tell by him checking his phone that the episode is going very well. As can the audience.
Oh, goodness.
Do that again for the camera.
Yeah, it's gonna look so fresh on. So is this like different money then? 100. Usually the 100 one, the bigger one.
Yeah.
Like a
So
dental burr of some sort.
It'll
Is it
never
called?
pulse through.
So it's a coarse sandpaper burr, and I'm gonna once I've done it, I'm gonna do a final one. I want it to be really smooth. I don't want food or anything to catch on my
Masterpiece.
masterpiece. Yeah. From all sides.
So from all sides.
Yes, I want to be able to smooth the tooth at every angle.
Tell me about the monitoring.
Nice boring anaesthetic. And boring anaesthetic's a good anaesthetic.
Discuss the different parameters there, please.
What are you actually monitoring?
We're monitoring what I'm adjusting right now. It's the ECG and the temperature. Oh, I had it right this
While you're doing, I'm changing to a much finer sandpaper burr because I'm going to make it. It's beautifully smooth, but I'm going to make it even smoother, finer, smoother. Do you want to go through like pulse ox or
So that tube you just threw down the throat, what's that?
That's the esophageal ECG probe. It is equivalent to a 3-lead ECG, but it's also got an attached temperature probe to it, as you can see on there. You don't have to go through all the hassle of attaching all your different points. Sure, its accuracy can be a little bit
T-skin thing is the temperature.
up here, is what we're talking about. It's reading the electrical activity of the heart directly from inside via the esophagus, of course, but it also gives us an internal temperature reading, currently 37.8. We started at 38.2. Next up, SpO2 pulse oximetry monitoring, which is just like that thing that goes on your finger when you're in hospital, but this one's attached to the foot at the moment, because we have another one attached to the tongue for 2 points.
And I'm in.
That reads the blood oxygenation level, so how well the patient is breathing. Normally we would also monitor the EtCO2, however that unit has malfunctioned. We very quickly picked up on that and have ordered a replacement. It is not vital to monitoring an anaesthetic because that's why you have all your different parameters and also multiple staff members watching your anaesthetic. Then we've got non-invasive blood pressure. Just like when you get your blood pressure taken, cuff on the arm, cuff on the leg, and it checks your blood pressure every few minutes that you set it to. All nicely graphed, and we graph it as we go as well.
And you will also show how we double check the two different units. So there's a separate pulse ox just double checking, which adds an extra level, and maybe discuss the infusion pump.
Ah yes, we also have supportive fluid therapy going for the patients. All surgical patients get IV fluids, which we record the rates, as well as how much they get throughout the procedure. This aids in keeping their blood pressure up. On that note, the blood pressure that you may have seen on the monitor is possibly not a very good reading, as Jack Russells have chicken leg style legs, where the top part is fatter than the bottom part, so the cuff itself can slip. Also, it doesn't have a firm hole, so it can be an incorrect reading from time to time, which is a constant battle.
An ultrasonic scaler. I'm going to scale the whole mouth. I'm going to use some prophy paste, polish the mouth, and we will hopefully have a healthy, beautiful oral cavity.
So this is the very end.
So we're now finishing off, it's the very end. So you can see what the teeth are like. It's very healthy teeth. You can see pretty healthy teeth to start anyway.
Did anyone get a photo of the before with this dog?
I didn't.
Look, the main treatment in this dog is really just the yeah.
It's going to be a very
Well, a happy owner because it's a great story. The pet belongs to someone. She's doing them a favor, and this is great. It's a great outcome. Like we could have told, we might have had to take out the tooth, you know, just depending. You can tell someone does a lot of dentistry if they put their Profi on the glove. I think most oral hygienists I've seen kind of do that.
So an essential part of a nurse's uniform is non-slip shoes, especially working with filling dentals. Water everywhere.
So it's like painting. We're trying to just we're trying to smooth the tooth and just paint the.
I honestly thought he was going to say cover the room with everything.
And I can't tell you as a vet how enjoyable these kind of cases are, because they just do really well and it's just a good outcome. You're also seeing that anesthetics is everything. Having a good anesthetic, good support staff, good monitoring. It's just brilliant. When I glance at this and it says 100, pulse ox is 100, and I see it 99 there. And I see a beautiful x-ray of the tooth.
You can hear the nice steady beep.
Yeah, that sound in the background. I mean, all those things make all the difference. So I'm going to be scaling and polishing the inside of the mouth as well, but I'll leave that for now. So as long as you guys have just seen you've just seen the
Main part of the dental.
yeah, you've seen the main part of the dental. Remember, teeth have got 4 sides. We're going to try and just do a little bit of the teeth on the inner sides. As opposed to human dentistry, we've just got so much in the dog's mouth here. There.
Yeah, I think we'll leave it. At the end of the dental video, this is us enjoying vegan burgers, and are we enjoying them, Ethan?
Not a chance. Not a chance.
Very much so. Absolutely delicious. And,
Really good.
no animals suffered during this, and it's a great reward for a really fun dental that makes veterinary quite rewarding.
And the rest of us are making fun of Ethan's face.
Yeah, that's terrible, that burger. I got a third of the way through it. No.
Yeah, nice to see a dental who end up so happy and, as you can see, recovered very well.
Very happy.
Very bright.
Happy to see Mum.
Bye, darling.
See you, Patches.
Come and get love.
No, dental.
Dental surgery. Bye-bye.
You're a bit of a Houdini, aren't you?
See you later.